Namaste Vidya, हमेशा खुश रहो बेटी. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Medical Science in JAYOTI VIDYAPEETH University. Today we are going to discuss about chronic pancreatitis and pancreatic carcinoma. This is the second lecture of the series Pancreatitis. In the first lecture, we have discussed about the definition and pancreatitis, and we have discussed about acute pancreatitis in terms of its causative factor, etiopathogenesis, clinical features, and management. In today's lecture, we are going to discuss about pancreatitis, second lecture with chronic pancreatitis and pancreatic carcinoma. So let's start with chronic pancreatitis. Chronic pancreatitis is a chronic inflammatory disease that is characterized by fibrosis and destruction of the exocrine pancreatic tissue. So there is usually fibrosis and destruction of the exocrine pancreatic tissue that is taking place. It is characterized by irreversible damage to the pancreas. So there is irreversible damage to the pancreas that is due to two factors: number one, fibrosis, and number two is destruction of the exocrine pancreatic tissue. The etiology, alcohol consumption is the most common cause of chronic pancreatitis, and in 25% of the adult, the etiology remains unknown. The other etiological condition consists of TGAR-O, that stands for toxic, metabolic, idiopathic, genetic, autoimmune, recurrent, and severe acute pancreatitis, and other one is obstructive. So, what are the different clinical features of chronic pancreatitis? So, pain is the cardinal symptom of chronic pancreatitis, and the pain is better by leaning forward and by intake of alcohol consumption. There is weight loss and steatorrhea. Steatorrhea is basically fatty diarrhea. There is also malabsorption syndrome. So, I will repeat the clinical features that consist of pain, that is the most cardinal symptom. The other symptoms include pain, but is better by leaning forward and intake of alcohol consumption. So this is an important symptom. Like patient says that he's having a pain abdomen, and the pain is better by alcohol consumption. So you get shocked how it is happening. The reason is chronic pancreatitis. There can be weight loss, steatorrhea, and there is malabsorption syndrome. Now, what are the various investigations that are needed to be done in case of chronic pancreatitis? There is no specific lab test for chronic pancreatitis. In contrast, when we saw the acute pancreatitis, there were a lot of tests which we have seen. The serum amylase and lipase level are normal. In contrast to acute pancreatitis, where it was rising 3-fold times. The serum bilirubin and alkaline phosphatase may be elevated. The small bowel biopsy is useful for the diagnosis of chronic pancreatitis. There is impaired glucose tolerance test that is present in greater than 50% of the patients. Now, there are various imaging techniques which are needed to be done for the diagnosis of chronic pancreatitis. The various imaging techniques consist of plain film of abdomen that reveals pancreatic calcification. CT scan can be done, there can be MRI, endoscopic ultrasound can be performed, and pancreatic function test can be done. So I will repeat the imaging techniques. It includes abdominal CT scan, then we have MRI scan, endoscopic ultrasonography, and pancreatic function test. Now, how will you manage the case of chronic pancreatitis? So, chronic pancreatitis, it is a long-term disease, and the management is aimed at controlling the pain and malabsorption. So, due to the chronic pancreatitis, there is malabsorption of in the patients with chronic pancreatitis. So, the treatment protocol involves controlling pain and malabsorption. The surgery with ductal decompression may control pain. Subtotal pancreatectomy can be done, and low-fat diet and pancreatic enzyme replacement can be done. The antacids treatment consists of omeprazole and sodium bicarbonate. Insulin intake to control the serum glucose is usually done. So, for acidity, we have 8 antacids. Insulin in case of diabetes, and low-fat diet is usually it. So, this was all about chronic pancreatitis. Now, we start with another small topic today, that is pancreatic carcinoma. So this is the image of basically the pancreas and the tumor that is happening in the tumor. Most of the cancers or Carcinomas are seen in the head of the pancreas. That's why this is shown. It affects 10 to 15 per 1 lakh Western population. Men is to woman ratio is 2:1. It is more common over the age of 70 years. So, pancreatic carcinoma is more common in men and it's more common over the age of 70 years. The risk factors includes increasing age of the patient, smoking, and chronic pancreatitis. So, if a patient is having chronic pancreatitis, then the chance of getting pancreatic carcinoma increases. What is the pathophysiology involved in cases of pancreatic carcinoma? 90% of the pancreatic neoplasm are adenocarcinomas, which arises from pancreatic ducts. So 90% of the pancreatic neoplasm are usually adenocarcinoma, which are arising from the pancreatic duct. Adenomas pertaining to gland. The tumor involves the local structures and they may metastasize to the regional node at early stage. So they involve local structures. So local structure involvement can be there and they can metastasize to the regional lymph nodes at a very early age. The majority of the patient have advanced disease at the time of presentation. So most of the patients have advanced disease at the time of presentation when they are coming to the physician. Now, what are the clinical features? Clinical features of pancreatic carcinoma. The pain of incessant and boring character. So there is pain that is incessant, that is not stopping, and it is boring in character, and the pain radiates from upper abdomen through the back and is better by bending forward. So the pain is radiating to the upper abdomen through the back and better by bending forward. There is weight loss. 60% of the tumors arise from the head of the pancreas. As I told earlier, that in the head of the pancreas, most of the tumors are present. And involvement of the common bile duct result in the development of obstructive jaundice. So obstructive jaundice can result in cases of pancreatic carcinoma. The other symptoms involved. The other symptoms consist of diarrhea, vomiting from duodenal obstructions, diabetes mellitus. There can be recurrent venous thrombosis, acute pancreatitis, or depression. So the other symptoms include diarrhea, vomiting, duodenal obstructions, diabetes mellitus, recurrent venous thrombosis, and acute pancreatitis or depression. The other clinical features include obstructive jaundice, abdominal discomfort. There can be pruritus, means itching can be present. Lethargy, patient may becomes very much tired of feeling. There can be weight loss and epigastric pain. I will again repeat these symptoms. The other symptoms include diarrhea, vomiting, duodenal obstruction, diabetes mellitus, recurrent venous thrombosis, acute pancreatitis, or depression. The other features also include obstructive jaundice, abdominal discomfort. There can be pruritus. There can be lethargy, weight loss, and epigastric pain. Some of the more clinical features of pancreatic carcinoma consist of backache, newly onset diabetes mellitus that was not previously present, acute pancreatitis, and nausea and vomiting. Now, what are the different physical examinations that could be done whenever a patient is coming to you with the complaint of pancreatic carcinoma? What will be find? There will be presence of any abdominal mass. There will be jaundice and cachexia, and there will be certain scratch marks on the body due to the presence of pruritus. There is an important sign that is known as the Courvoisier's sign. Courvoisier's sign consists of palpable gallbladder in the jaundice patient. Is usually the consequence of distal biliary obstruction by the pancreatic cancer. So Courvoisier's sign states that if there is a palpable gallbladder in the jaundice patient, and that is usually consequence of distal biliary obstruction by pancreatic cancer. Now, physical examination consists of other related to the distal metastasis. If there is distal metastasis, then we can find hepatomegaly, ascites, left supraclavicular lymph node enlargement, that is lymphadenopathy, that is known as Virchow's node, and periumbilical nodules, that is systemic Joseph nodules. So, these are the important findings that are present in the cases of distal metastasis. That includes hepatomegaly, enlargement of the liver, there is ascites, left supraclavicular lymph node enlargement, that is Virchow's nodes, and periumbilical nodes, that is systemic Joseph nodules. What are the various investigations that could be done in case of pancreatic carcinoma? Number one is ultrasound can be performed. We can go for contrast enhanced CT. Laparoscopy with laparoscopic ultrasound. We can go for CT guided cytology or biopsy. And the other important investigation includes MRCP and TRCP. These are very important investigations that we are also going to study in case of biliary calculi or gallstone. How will you manage the case of pancreatic carcinoma? The most important treatment is surgical resection of the carcinoma, and if the metastasis has taken place, then we have to go for chemotherapy that will include 5-fluorouracil and folinic acid. So this was all about gastric pancreatic carcinoma. What is the poor prognosis? The prognosis is usually poor with the survival rate of only 3 to 5%, the median survival of 6 to 10 months for those with locally advanced disease and 3 to 5 months of metastasis. So if a case comes to you with pancreatic carcinoma, then the prognosis is absolutely poor. The patient is not going to survive more. So in the next lecture, this was all about pancreatitis, acute, chronic, and pancreatic carcinoma. In the next lecture, we are going to start with inflammatory bowel disease, in which we will be discussing about ulcerative colitis and Crohn's disease. So this was all for today. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box. So this was all for today. Thank you very much. We will meet in the next lecture tomorrow.